And also, changing topics just a bit, are you or someone you know suffering from restless legs syndrome? If so, we have some really big news for you.
RLS has only been treatable by medications until now. I spoke with a doctor to find out more. Well, it's a living nightmare. During an RLS attack, a person may feel uncontrollable tingling, aching, or pain in their legs, usually while they are already resting, sitting, or sleeping. Sleep deprivation is reaching an epidemic proportion in the U.S., but for those suffering with restless leg syndrome, we may have some great news for you this morning. Joining us is nationally known expert on RLS, Dr. Mark Buchfuhrer. Doctor, thank you so much for joining me this morning.
Oh, it's a pleasure to be here.
Now, a lot of us know that insomnia is actually becoming a much bigger problem in the U.S. and potentially with some, very big health concerns. Will you talk a little bit about that?
Sure. Insomnia is an increasing problem affecting millions of Americans. It can cause fatigue, of course, but even anxiety and depression, and it increases the risk for many other health conditions such as diabetes, heart disease, high blood pressure, and obesity. Of the people who suffer from insomnia are the 10% of the adult population that has restless leg syndrome. They have even more insomnia, and they're even more prone to the health consequences of insomnia.
And it's surprising to hear just how many health consequences there are from insomnia. Now, will you talk a little bit about restless leg syndrome and exactly what that means?
Okay, RLS, or restless leg syndrome, is a neurological sensory and motor disorder that causes patients to experience these really uncomfortable, unpleasant, very hard to describe sensations in their legs associated with this irresistible urge to move their legs. When they get the symptoms, which occur at rest, the only way they can relieve it is by rubbing or moving their legs, or especially getting out of bed and walking. And since restless leg tends to occur at bedtime, these patients experience a lot of sleep disruption. And RLS gets worse with time, usually over decades, and before it's treated, it can cause many years of sleep deprivation.
So, doctor, how is somebody with RLS treated?
Well, until very recently, the only effective treatments we had were medication treatments. And the issue with the medication treatments are that they're not always effective, and they can cause significant side effects. In addition, the two most commonly prescribed treatments actually make restless legs worse over time. So it's great that we have the first non-pill, non-drug treatment FDA approved, which is Relaxis. And what this Relaxis device is, it's a medical device, a vibration pad that the patients put under their legs. They can control the amount of vibration they get. When they have a restless leg attack in bed, instead of having to rub their legs incessantly, get up and walk, which disrupts sleep, they simply turn that device on. It takes care of their restless leg symptoms so they can stay in bed and get sleep.
Well, this is definitely
now, this device has been
this is some great news for people with RLS. Doctor, has this been clinically proven?
Yes, there's been 2 studies that the FDA used to approve this for restless legs. They were multi-center, randomized control studies, and they showed that these patients who used the device had improved sleep. In fact, I've used this on many of my own patients in my practice, and they have found that it helps their sleep and they feel a lot better.
Excellent. Doctor, well, where can patients go to get more information?
Well, the first thing patients should always do, of course, is speak to their own physicians about whether their symptoms warrant treatment with any treatment, whether it's pill or the Relaxis pad. But what they can do if they want to get some more personal information is go to the company's website. They can do a self-assessment test to see if they have restless legs and if the device is warranted at myrelaxis.com.
Excellent. Doctor, well, I want to thank you so much for joining us this morning.
Oh, you're very welcome. It was a pleasure.
Now stay where you are. The Morning Blend will be right back after this.